G'day everyone. We've got a few minutes to talk about death cap mushrooms. In the southern hemisphere, it's almost exclusively a Canberra problem. Amanita phalloides is thought to have been imported here with oak trees, which are popular in our leafy inner north and inner south suburbs. Let's talk pathophysiology. The cyclopeptide toxin alpha-amanitin is mainly responsible for the toxic effects in humans. There's enough in 1 to 2 medium-sized death caps to kill a human. The toxin is heat stable, so cooking doesn't help. It's absorbed incompletely from the GI tract and transported to the liver via the portal circulation. An organic anion transporter in the hepatocyte membrane actively takes it up and concentrates it within liver cells. Once inside the cell, it binds to a DNA-dependent RNA polymerase. This halts intracellular protein synthesis. Apoptosis results, and this can lead to fulminant hepatic failure. Delayed onset of signs and symptoms, more than 6 to 12 hours, is consistent with a serious death cap ingestion. Clinical manifestations are categorized into 3 phases. In phase 1, patients typically develop abdominal pain, vomiting, and severe cholera-like diarrhea. Liver enzymes and bilirubin are usually normal at this stage. In phase 2, there's a gradual resolution of the dysentery, but elevations in liver enzymes become evident, with peak levels occurring 60 to 72 hours post-ingestion. In phase 3, severely poisoned patients develop hepatic failure, often accompanied by acute renal failure. Pancreatitis occurs in half of severe cases. These patients need good supportive care, particularly fluid resuscitation and correction of electrolyte disturbances from fluid losses. Amatoxins bind activated charcoal, and because they're excreted in bile and recirculated, 50 grams of activated charcoal is given every 4 hours for about 4 days, provided there's no bowel obstruction. Silibinin is an extract of Mediterranean milk thistle and inhibits amatoxin uptake by the hepatocyte. It also has antioxidant effects and enhances excretion of the toxin into the bile. It's given at a dose of 5 milligrams per kilo as an IV loading dose, and then 20 milligrams per kilo per day for at least 3 days. If you don't have it, high-dose benzyl penicillin may achieve a similar thing. Amatoxins are known to enhance lipid peroxidation, and this contributes to cell death. NAC is the antioxidant given, and the standard dosing for paracetamol toxicity is used here. Consult your toxicologist for duration of therapy. And that's Amanita phalloides poisoning in a nutshell.